facilitate the local voice linking up to the NHS Citizen initiative. And our group actually had quite a big discussion in the morning about this sort of topic area.
I'm Emma Stafford. I'm a patient rep from Bradford.
My name's Virginia Sainer, and I'm the Partnerships Manager at Charity called Change, which is based in Leeds. It's a national charity, and we primarily work with the Led by Learning Disabled people, accessible information, delivery and training, and lots of campaigns and stuff like that.
I'm a member of my patient participation group in my GP practice in South Wales, London and Merton, and in my day job I work with charities.
I'm Jane Barrett and I work in the Department of Health in a relatively new post for me, which is Head of Patient and Public Involvement Policy. And one of the things that I'm involved in particular is a project looking at self-care and the contribution that technology can make to enabling self-care agenda.
Brian Norris, I'm based in Cornwall, and I'm interested in this group for two reasons. One, I had a heart attack a couple of years ago and did the NHS rehab programme, etc. There was no exercise group for me to follow on with, and so I managed to set up a group, got some funding to do that for an exercise group for older people with heart and other long-term conditions. And so we were interested in creating an app which we could work with the GPs to monitor the patients after as they were going through our programming to show the benefits that they were getting. We're also just at the point of beginning to work with South Devon and Torbay Care Trust on a project they have, which we're developing an online delivery system to go into Torbay Hospital with our reminiscence resources, which they're recruiting volunteers at the moment who can then use iPads with our reminiscence resources to work with older patients in the wards. So exactly how the timing is going to work, I don't know. So again, we don't have funding to get the app up and running. The online service, we've got meetings tomorrow, so that should be up and running within the next month.
Exciting stuff.
My introduction is very brief.
Sorry, too long.
No, it was really interesting. My name's Katie, I work for the British Heart Foundation. I'm the user program manager.
I'd like to thank you for...
Right, Jane, we've been looking at the fantastic range of people that are just here, come together, talking about all the challenges about apps and health policy. If you had to sum up what you've been discussing and what your main topics are, what would you say?
Well, our group has been focusing on the power of apps, and we've identified 4 key things. One is we think there is actually a gap in some of the apps that are currently available to make sure they really meet how people live with health conditions. We also think there's a big issue around the apps that do currently exist about their quality and their standards so that people can actually feel okay to use them. And then the third thing is not everyone knows what apps are available, so there's something around promoting their use to people with health conditions. And finally is around being able to use them confidently and appropriately.
Brilliant. Well, thanks very much, and thanks to all the rest of you for a great session just discussing. There we go, so he's spinning around, discussing various challenges with apps. Okay, thanks very much.